All right, I'd like to welcome you all. We're going to go ahead and get underway. I'm Matthew Bolton. I'm the Senior Associate Dean for Global Health at the School of Public Health, and I'm a professor in epidemiology at the School of Public Health and also in internal medicine and infectious diseases at the Medical Center. So I'd like to welcome you to our Careers in Global Health. It's part of the International Career Pathways Month of events. I think, Jerry, this is the third time that we've done this event. And it's organized by a wide group of campus offices, centers, and schools. So the official sponsors for tonight's event is the Office of Global Public Health at the School of Public Health. And I'd like to introduce Chineri Neal, who's staff in the office and knows a lot about global health, having worked in that sphere for a long period of time. And there are co-sponsors of the Office of Global Outreach at the University of Michigan School of Nursing with support from the International Center. So our goal for tonight, the program, is to give students some ideas and direction on preparing for global health careers. And this has been an area of burgeoning interest among school students in the School of Public Health. And I teach the undergrad global health class, the Public Health 350 class, and I know that the students there have expressed tremendous interest in securing careers in global health. And also on the breadth of opportunities that may be available to them with appropriate preparation. So we're extraordinarily fortunate in having 4 distinguished speakers tonight, and we'll be having a panel discussion, so they'll each be presenting, and then we'll open it up for Q&A with the audience. So hopefully we can have a dialogue between all of you and our speakers. So all 4 of you will have to forgive me because I'm going to use an abbreviated version of your very long and distinguished biographies. So on the far left is Robert Leone with the Global Health Fellows Program 2. Bob is the lead for Outreach and Communications with the Global Health Fellows Program 2, or the GHFP2. In that role is responsible for the program's comprehensive outreach strategy and participation in over 50 events annually that engage a diverse cross-section of individuals interested in the field of global health. The information offered includes opportunities through the Global Health Fellows program, skilled sought preparations for careers in global health, and ways to make your material stand out in a sea of competing resumes. And of course, it is a very competitive environment these days. In addition, he crafts a variety of communications outreach materials designed to tell the Global Health Fellows program story. And then next to him, we have Shannon Prudhomme. And Shannon is a Senior Business Development Officer at FHI 360, formerly known as Family Health International. The Louisiana native completed her first undergraduate global health internship experience with Africare Zimbabwe in 2003. This role was funded through an initiative funded under the University of Michigan's former Population Fellows Program Office. Oh, I didn't know you were a Population Fellows. Sorry, I'm learning things here, right? Upon earning her Master of Public Health degree in 2005, she began her career by working in the domestic HIV and AIDS care system as a health planning coordinator in Houston, Texas. And she has had extensive global health experience, and I think we're going to hear more about that tonight. Next to her then, we have Frances Tane, who's with John Snow International. She's currently based in Boston and has been a member of the international division team at John Snow since 2006. Since working at JSI, which is a public health consulting firm with projects in the US and around the world, Fran has provided program management support and technical assistance to teams in South Sudan, Nigeria, Zimbabwe, and Ukraine, and is currently supporting development of JSI's portfolio in Myanmar. Her main area of public health interest is maternal, newborn, and child health. She has an MPH from the University of North Carolina, Chapel Hill, and an MS from the University of Michigan School of Natural Resources and Environment. She's also a returned Peace Corps volunteer, having served in Nepal from 2003 to 2005. And then finally, last but not least, we have Patty Abbott from the University of Michigan School of Nursing. Patty is an associate professor at the school. Prior to arriving here at UNIVM, she was an associate professor at the Johns Hopkins School of Nursing and Medicine. She completed a 2-year postdoctoral NIH-funded research fellowship in the Department of Computer Science in the Human Computer Interaction Laboratory at the University of Maryland, College Park. where she focused on the design of usable and error mitigating health IT. Pat extended her research background in knowledge discovery in large data sets, data analytics, at the Human-Computer Interaction Laboratory by focusing upon visualization that is making sense of huge collections of healthcare data in a way that provides value in addition to human-computer interaction and user-centered design. So as you can tell, it's a great group with lots of experience in global health. And Chineri, how do we want to proceed with the presentations? Do we have a particular order in mind?
Start with the problem.
Sorry, please.
Well, thank you for the introduction. Can you all hear me okay?
Pull the mic a little closer.
How's that? Better? Better? Yeah.
Are they on?
Hello?
Yeah.
Yes.
There we go. Okay. I'd like to start off by talking a little bit about our program, the Global Health Fellows Program 2. And we're a 5-year cooperative agreement with USAID, the U.S. Agency for International Development. And the vision of our program is to develop a diverse group of global health professionals at different stages in their careers, and then to support, sustain, and strengthen the effectiveness of USAID's global health work in Washington, D.C. and overseas. Currently, we have about 110 fellows that are active on the program, and they work in a variety of different technical areas and at different levels, roughly junior, mid, and senior level folks. And then also currently we have about 22 interns that are, some of them are holdovers from this past summer, and others are what we call on-demand interns, that and those positions kind of pop up on an as-needed basis throughout the year. And we'll also have a cohort of between 35 and 40 interns for this coming summer of 2015. And I'll talk a little bit more about the internship program in a minute. And so the fellows and the interns work, as I said, in a variety of different technical areas, including family planning, maternal and child health, HIV/AIDS, health policy, gender, malaria, infectious diseases, and cross-cutting initiatives such as population health and environment. And then in addition, we also have several partner organizations that we collaborate with. And I'm going to mention a couple of them because they might be of interest to folks here. I'm not sure what the makeup is if we have a mix of grad students and undergrad. Yep. Great. So one of the organizations that we work with, and we actually fund some of their internships, is an organization called GlobeMed, which is a campus-based organization, and they offer overseas internships to undergrad students. And there is a chapter here at the University of Michigan, and they also pair the chapter up with an organization in country that they work with virtually throughout the year, so that they have that opportunity. And then there's the summer internship piece of it. We also work with another organization called Global Health Corps, and also fund some of their fellowships, and those are one-year overseas fellowships at the junior end. So the requirement for those is that you have to have a master's degree and be 30 years old or under. So in addition to the recruitment, placement, and support of global health professionals, we also provide information and services to help individuals prepare for a career in global health. So that's why I'm here, is part of that program, and I manage that outreach piece for GHFP. So we do career fairs, we attend conferences, we do webinars. We're actually going to have a webinar on November 5th that will have a small panel. Several of our current interns will be on the panel, and it'll be internship focused, so it'll be giving you some ideas about what the internship program is like, how the folks that actually got their internship, sort of their background and the way they approached it, sort of their strategy for applying for the internship. So we do a variety of different events like that. Just to give you an idea, the past program year, which ended for us on September 30th, we participated in 87 different events around the country. And we also invite current and former fellows and interns to be part of that outreach so that people can sort of have a little bit of a first-hand knowledge and not just listen to staff people like me talk about the program, but they can also find out what people are doing firsthand. And then I wanted to talk a little bit about another aspect of the program, which is very important to us, and that is reaching out to individuals that are underrepresented in the field of global health. So towards that end, we have a focus in our outreach on visiting historically Black colleges and universities, Hispanic-serving institutions, and other minority-serving institutions, as well as schools that have large minority student populations. So, for example, we have a lead for diversity and inclusion, Dr. Fred Fuentes, and recently he attended the conference of the Hispanic Association of Colleges and Universities in Denver. He was also exhibiting at the HBCU Week conference in Washington, and currently he's making the rounds of Hispanic-serving institutions in Texas, and so he does a lot of travel. And reaching out to schools and sort of forging alliances and not just sort of doing presentations, but also figuring out ways that that we can collaborate with them sort of going forward. I also wanted to mention another fellowship program, which is separate from ours. I just want to emphasize that. But nonetheless, it's a great program. It's called the Donald Payne International Development Graduate Fellowships. And that fellowship program provides financial support towards a master's degree and internships in Washington, D.C., and at USAID missions overseas. So it's a USAID funded project also. And you must be a senior or beginning a master's program. And there's an application deadline for that of January 20th, 2015, and there's an online application which is currently available at Payne Fellows, and that's P-A-Y-N-E fellows.org. A couple of other things I wanted to talk about. Since Ebola has, been so much in people's minds and in the work of global health, I just wanted to mention a little bit about what some of our folks are involved in. Currently, we have a fellow who's been there for some time now, based in Liberia, and he is. So, needless to say, his scope of work has changed drastically in the last few months. But the name of his position is Cross-Cutting Health Advisor in the Health Office at USAID Liberia in Monrovia. So that's sort of a very wide scope of things to be involved in. But we've been in pretty close touch with him, and I recently received an update that I just wanted to sort of paraphrase a little bit of what he said. And this was just recently came in just a couple of days ago from him. And he talks about the fact that they're beginning to see the very early signs of improvement in the Ebola situation in Liberia. For the first time, there are empty beds in many of the Ebola treatment units across the country. And while it's true that there are more treatment units have been set up, there is evidence beginning to surface that the actual number of new infections are declining. Although he tempers that, saying that this is the early days and not yet time for celebration. And a little bit about the work that he's been doing there. His main task is to work with the Ministry of Health and other partners to reduce the relatively higher risk pregnant women and children, relatively higher risk that pregnant women and children face in this epidemic. And they've developed a maternal, newborn, and child health package and protocols to be used in all health facilities there. And we also have two other fellows that are not based in East Africa, but have volunteered to go. One just left for Guinea, and then there's another one that's also going to Liberia for a short period of time. And then finally, I just wanted to say a little bit about the fact that if you're interested in having us do a one-on-one informational interview with one of our staff people, they'll look at your resume, talk to you about any questions you might want to have about where your career is going. You can sign up for one of those on our website, which is ghfp.net, and you can also sign up there for our mail list, which will send you notices about the openings that we have, the internships and the fellowships. It'll also send you registration information about the webinar that I mentioned, which is coming up on November 5th. And then finally, if any of you are going to APHA in New Orleans, we'll have a presence there. We'll have a booth, and we're also doing a reception on Tuesday evening, which is kind of more of a fun thing, social reception, but also a great opportunity to network. So if you're there and you can make it, please stop by. And also I have some materials here, so at some point feel free to, pick some of those up.
And Robert, for the students in the audience who are not familiar with APHA, that is?
Yes, that's the American Public Health Association, and they do quite a large annual conference every year, and it sort of moves around to different cities. So this year it's in New Orleans. And a lot of the conference is focused on domestic health, but there is a portion of it that's has a global health focus. And it's big. There's a huge number of people come for that, and there are workshops and sessions, and there's a huge exhibit hall where different organizations are there, and we just kind of go around and talk to folks.
So I think, Shannon, we'll just go with you. So we'll hold questions to the end, and then you can put your questions off for the panelists.
Hi, I'm Shannon. I am the Senior Business Development Officer at FHI 360. We're headquartered in Durham, North Carolina, but our largest office is located in Washington, D.C. We also have a regional South Africa office, various country offices, and a regional office in Asia in Bangkok. We have a presence in over 60 countries. In terms of our technical specialists, we have specialists in the areas of health, education, civil society and strengthening, youth, gender, etc. North Carolina is actually our research office. We began as a program out of UNC in 1971 as a fistula project, and eventually we branched off into our own organization. I've been working for FHI 360 since October 2012. And on the pre-award side. In terms of opportunities for students, there's internships that are posted year-round on an as-needed basis versus possibly at a point where students may be looking for internships during the summer. So it's great for you to look at the website and see what opportunities we have. We also have a fellowship program. And our country offices are always looking for interns as well. I work at the research office, I think I mentioned, in North Carolina. In terms of Washington, D.C., that's actually our program office. So programs that are on the ground and a lot of what we call bilateral funding from USAID, funding that comes directly from the mission in those countries. Those are managed out of our Washington, D.C. office. So depending upon your interests, you may want to work in the North Carolina office or seek opportunities in the North Carolina office if you're interested in research, or if you're interested in more programs, the Washington, D.C. office may be an appropriate office for you to pursue opportunities. In terms of staff, we actually have a broad array of staff. We have graphic designers, we have economists who work with us, we have people who are social scientists. We also have writers. We hire writers as consultants. We also have full-time scientific writers. So there's an opportunity in this space for people with various skill sets. We also have a GIS specialist in our social behavioral health sciences department, who's an asset to all of our researchers who are seeking to gather geographic data in their research projects. So I encourage you just to feel as if you have a space in global health, and I know that's why you're all here today. But at FHI 360, we have various specialists with various expertise, as I've learned in my 2 years there. So.
Excuse me. So talk a little bit about your career path and how you got
sorry. Okay. I'm a senior business development officer there, as I mentioned. My career path actually began Through University of Michigan's Population Fellows Programs, I was an MSI intern. The MSI program was the Minority Serving Institutions Initiative. I'm a graduate of Xavier University of Louisiana, which is an HBCU in New Orleans, Louisiana. I'm a Louisiana native. I was a communications major and biology was my minor. I was also a health writer for the campus newspaper. So I was interested in public health, but more domestic public health. Once I was awarded the internship, the summer between completing undergrad and beginning grad school, I was seconded to Africa Zimbabwe. We trained for about 2 weeks, I think, on the University of Michigan campus. And that project actually focused on me serving as a project coordinator in developing a storybook for children affected by AIDS in rural Zimbabwe. And it actually aligned very much with my experience in communications. I had to do a lit review, I had to come up with a concept, I had to interview creative professionals in the country and also complete a focus group in rural Zimbabwe. So it actually shifted my interest from domestic public health to global public health. When I started my master's program here, I decided to pursue my capstone or my internship for my MPH program in Botswana. My supervisor at Africa Zimbabwe the previous summer connected me with my capstone opportunity that was in Botswana. So it was really great for me to network, and actually I'm still in contact with her, and we're actually very good friends. When I completed my capstone, of course I returned to University of Michigan, completed my MPH in the HBHE department, which is the Health Behavior and Health Education department. Pursued a domestic career in Houston, Texas. I worked with Ryan White funded programs as a health planning coordinator. Specifically, I conducted needs assessments and did a lot of, I guess, big picture planning for HIV services in Houston and East Texas. But that was proven to be an asset for FHI. I thought it was a bit removed from global health. When I applied for my position over 2 years ago, they had just acquired AED in 2011, the Academy for Educational Development. So they were merging with an organization that did domestic work. So they acquired a domestic portfolio. So now, including doing work in 60 countries, they also do work in the US and all its territories. So my domestic background was viewed as an asset to the organization. So it was good marketing for me. Actually, most of my experience now that I've been working with FHI has been more with the international proposals, because the leader of our US portfolio is based in DC and I'm based in North Carolina. So I was able to still leverage my domestic background and the skills I gained from working in Houston, Texas as an asset for an international development organization. And I've been there for 2 years, growing every day and learning. Most recently, I traveled to Tanzania for 4 weeks for an assignment for an opportunity that we were pursuing. And it's been a process I'm grateful for. And I do, even though writing isn't required in my position, my writing background is actually an asset. Now that a lot of our researchers know that I'm a great writer, I have an interest in their research, I'm often tapped to write sections of proposals, even though that technically wasn't part of my job description. It really was to manage the process. So I've had an interesting career, I've enjoyed it, and both my domestic and my international experience have come together at FHI because they have a broad portfolio, international and throughout the US.
So Fran?
Yes.
Okay.
It's glowing green.
Well, just grab the one.
You know,
Probably has a dead battery or something.
Thank you. So thank you so much for being here, everyone, and thank you very much for hosting us. I feel very much at home here. I have already discovered many connections to people in the room that I did not anticipate. So Robert lives where all of my family live in California. Shannon actually is here from North Carolina, where I also went to school. I am a University of Michigan alum, so it's very nice to be home after I think what might be a 15-year absence. So I barely remembered actually where the union was, I'm ashamed to say. One of you in the audience I've had the great pleasure of actually working with recently, so Erin, it's very nice to see you here. And I have an enormous respect for nurses. So I think clearly I have come to the right place. I should start by asking who here in the room has heard of JSI, John Snow Inc.? Okay, great. Or maybe you know us by another name, JSI Research and Training, Inc. It's actually two separate companies, but both are known collectively as JSI, and it's nice to know that some of you have heard of us. We are an international and domestic, actually, public health consulting firm. We are based, our headquarters is actually in Boston, but we have a very, very large presence in Washington, D.C., and we also have, I think, 7 or 8 very small offices, or relatively small offices, in other places in the U.S. The other U.S. offices mainly focus on U.S. domestic public health activities, and so, unfortunately, me coming from the international division, even though I continually petition to try and get to the San Francisco office, no one listens to me. So I am here today actually from the Boston office. I have worked in the international division for about 8 years now. Just to say that I will also, a colleague of mine and I will also be here tomorrow at the regular career fair. And so if you don't get to ask a question today, or if you'd like some materials on JSI, we will be at the career fair tomorrow, so be sure and stop by. I'm not quite sure if you actually are interested more in knowing about the organization that I come from, or if you are more interested in knowing about career paths. Career paths, okay. So the bio that was read about me is sort of the highlights. I hope it wasn't too dull. It's sort of a very traditional trajectory, I think. Who here in the room has been in Peace Corps or is planning to go into Peace Corps? Okay, excellent, great. So of course Michigan has a very rich tradition connected to the Peace Corps program, and actually I think the last time I may have been on a panel at Michigan was actually for Peace Corps. So it's also a program that's very near and dear to my heart. But my Peace Corps experience basically sort of started my interest in international development. I always knew that I was interested in working overseas and doing some type of work that came, that essentially had a social benefit associated with it. But I think when I was younger, I wasn't quite sure what direction that would take, so Peace Corps seemed like a very good first step. And Peace Corps service is actually very, very common within JSI, because I think that people have, with that mentality, sort of tend to find each other. And so public health and social work and education and agriculture, we all somewhat are like-minded, and so we tend to find each other. So I do actually have 2 different master's degrees. I'm one of those weirdos who actually did not do a combined program, but actually did 2 totally separate programs. And sometimes people ask me if I regret having done that. And my answer actually always is that I believe that any time spent well and meaningfully in any sort of program that is growing your brain, I don't know why you would ever regret having done that. So I'm actually quite thankful for the time that I spent at U of M. I did go to the School of Natural Resources here, which I just visited and did not recognize the building at all. But it was very pivotal, and I'm sure whatever it is that you are studying, and no matter where it is you intend to go, as long as you feel that you are learning how to read and write and think critically, I really don't believe it matters what program you're actually in. And I think that my education, in every institution that I've gone to, but particularly here, I think, and actually I just saw my old advisor and I credited him with, in fact, improving my writing considerably, and I think he might have actually sort of teared up, but I do think that was very important. This was a very important phase in my career. So when I was here, I actually did study international aquatic ecology, because what I was starting to get more interested in was the intersection of agriculture, food security, nutrition, and development. And in the Peace Corps, I was a fisheries volunteer, so it was very much in line with that. And after I graduated from here, I went to Washington, which is, I think, a very typical location for a lot of people to go, even if they don't quite have a job yet. But there's so much work that's being done in our sector, because of the government's, being situated there and all the rest. So I headed to Washington, got a job on a USAID funded project called the Environmental Health Project, which was a global project working on health and hygiene. And through that, I really got introduced to the area of public health proper, sort of less on the food security and nutrition aspects and more on actual public health interventions and what that means. And so I worked in Washington for a few years, and then I got married, moved overseas, and actually sort of wandered around Southeast Asia for a while looking to see who would offer me a job. And for any of you who think that that's a totally nuts idea, it kind of is, but it kind of isn't. So if you have the luxury or the sort of adventuresome streak to want to go and do such a thing, I highly encourage it because one, it's really, really fun, and two, Southeast Asia is actually really affordable compared to some other places, and three, you just, I sort of, I think that having a life that is so mapped out sometimes, you know, I don't know how you feel about that, but I kind of feel like I need some unpredictability, you know. So I wandered around and I ended up in Cambodia working as a child survival program coordinator for CARE. And I did that for a year, lived in a province in Cambodia, and then I spent my second year working as a consultant to WHO. Both of those were highly educational, of course. And I think that really, for anybody looking for those opportunities, I would say that one, I would not have gotten either of those jobs by sending in resumes from here. I was in no way qualified. I did not have the expertise or the sort of skills that they may have thought that they were looking for. But a lot happens when you're on the spot, actually, and when you can actually look people in the eye and explain, you know, what you might be able to do for them, demonstrate your earnestness and your diligence and your willingness to actually sacrifice and to, give of yourself. I think that that's very powerful. So that's, my plug for just sort of jumping off the cliff every now and again. After Cambodia, I came home, and my husband at that time wanted to go back to school, and so I decided to go with him since we were going to be living in a college town anyway. And so that's when I got my MPH at UNC. And UNC, I can't quite tell which one I favor, UNC, living in Chapel Hill versus living in Ann Arbor, but they're both definitely my top two. At Chapel Hill, I was in the maternal child health program. I know I'm probably not supposed to say this, but UNC is a great place to go to school, so if anyone is looking for an additional public health degree, okay. If anyone is looking for your next public health degree, you might take a look at it. But, and then from there, I went to Boston because my husband wanted to go to school in Boston. And an interesting thing happened when I was thinking about Boston. I didn't know where I was going to end up working. Boston has some, actually is fairly rich in international public health agencies compared to a lot of different places. But I still didn't really know where I was going to end up and how to actually get in somewhere. I had a sort of burgeoning resume, but it wasn't particularly, outstanding or special in any miraculous way. And so I sort of went back to my old networks and I asked a lot of people for advice and knew that if it came down to it, I would be willing to work for free or, to intern, to essentially do whatever it took, despite the fact that at that point I had 2 master's degrees. I really just recognized that I was willing to do whatever would be necessary to get where I wanted to be and to spend time with people that I could learn from. And so I actually contacted my old, actually a colleague from my environmental health project days, and for any of you who is in the room who may have heard this story before, I apologize, but it's actually really, it resonates with me. So someone told me that, to contact this person who is actually the director, was then and continues to be the director of JSI's International Division. And they said, oh, you should contact him. He'll remember you. And I was like, there is no way that man is going to remember me, because I had met him like 6 years previous. I was very young, and my sort of position in the project in which we were engaged was so far below his. And so I said to my friend, I said, there's no way that he's going to recognize, remember me. I'm sure that I served him coffee. And so she says, oh, friend. She's like, you're always so hard on yourself. I'm sure you also got him a sandwich. And so, another lesson there is just be brave and contact people, and you never know who will remember you. And in this case, he did. To my great surprise, he did remember me, and he asked me to come in to JSI, and so I went in, and basically he didn't have a position for me at the time, but what he said was just start. You won't get a title and you won't have a job description, but just start. and just see what happens. And by my own admission, this is a very rare, I think this is a really unusual thing to have happen. I don't necessarily know that it happens a lot. You know, and I think that clearly today's economic market is perhaps different from when when this happened to me. But he's essentially, the message was, if you are okay with a level of uncertainty and vagueness, and if you don't need to sort of pin your identity to a very firm, you know, job description and title, then, you know, things may happen. And so that's what I did. So I started, and basically, what he did very thankfully was he had me shadow, actually, the most junior members of our division. And he said, you are not one of them, but I want you to actually know what it is that they do, because a lot of people actually come in above them and they never appreciate or understand what happens at that level. And he said, I want you to actually understand what happens at that level. And so I basically just put my head down and I shadowed, you know, these project coordinators. And I did their jobs with them, I did their tasks. When they were out of the office, I actually would cover for them, in addition to doing other things. And I tell you, that was one of the best educations that I have ever had. And to this day, 8 years later, I still use those very same skills. It helps me to actually talk with every person in the division, no matter what it is their role. And it actually helps me to manage other people more effectively. And it actually helps me to identify when things are going well and when things are not going well, because I actually know the details, where a lot of people may not necessarily appreciate those details. So, you know, maybe I'll stop there, but I think that there are some nuggets in there maybe about sort of putting maybe, you know, just being willing to sort of work, maybe anonymously, maybe on the cheap, maybe taking some risks. But that if you actually, you know, just put yourself out there and really put your energy behind it and not worry about the rest, sometimes actually amazing things can happen.
All right, Patty.
Well, I'm very humbled to actually follow all these folks, and I think, you know, what's resonating with me and a common thread that I'm hearing is that it doesn't seem like any of us so far planned to be where we ended up. So it's almost like serendipity. And I'm hearing the things that you said, you know, some of the themes were, you know, being willing to sacrifice, to work hard, to be humble, you know, to be brave, and sometimes just starting at the bottom and figuring out what do all of the people that you're working amongst do. So I can, just in reflecting on some of those thoughts and themes, and then coming back to the introduction that was given for me, you're probably thinking, oh my word, she's really a weenie. And because I am a nurse, but I kind of stepped over a wee bit to the dark side, as they call it, and started working a lot in technology. And I did that. I mean, I've always been a tinkerer. And so my dad used to say that when all the other little girls were out playing with Barbies, you know, Patty was in the garage disassembling toasters. And I've always wanted to see how things work and what we could do to make them work better. And so when I first came out of nursing school, I ended up in an operating room, which in reality turned out to be a perfect fix, because it was like a lot of technology and people were broken, and we would bring them into the operating room and sort of, you know, work on them and try to see, you know, why were the intestines not working, why were we having stomach ulcers, and these sorts of things. So it became very much about a systems approach, looking at how things work together, what happens when they don't work together, and how maybe you can put them back together to get them to work well. So I actually started with an Associate of Arts degree from a community college. I worked 5 years at a McDonald's to put myself through school. So I don't have this glamorous path of how I got to where I got. I was the first person in my family who ended up with a college degree. I just moved here to Michigan 2 years ago. I come from a long history of Chesapeake Bay watermen, fishermen. And so I don't have a huge, deep academic roots and, research and this sort of thing. I'm more just a gal from the country, I like to consider myself. And, I wanted to be a nurse because I wanted to help people. But I always had this little weird thing on the backside that was kind of like the tinkerer, let's put some things together. So I was recruited to Johns Hopkins. I was actually at the University of Maryland at the time. I was practicing in informatics, and informatics is just the application of computer science, information science, and whatever your health science is, all sort of focused on either a patient or a population. So it's not about the technology, it's about how you take the technology to work on a given group. And so I got recruited away from Maryland by Hopkins because they needed a director for their collaborating center, their WHO collaborating center, and it was on something called knowledge management. And so you heard the talk in or sort of the introduction that was given on how I work with, with big data, and I was interested in, we've got all this data coming in, now what do we do with it? Do we just leave it in a database somewhere, or do we invent stuff out? What do we do with it? And plus, how do we make it usable? So anyway, so this all came together. We're generating all this knowledge, and we're not maximizing the value of that. And when I came to Hopkins and ended up directing their collaborating center, I took that aspect of data and knowledge management and ended up applying it to global health. Because for those of you who have experience or have been involved in global health, and I'm not disparaging anybody or anyone who's done anything, but what I have seen in 15 years in this field is that we continue to reinvent the wheel. What's old is new again. And I'm like, didn't we already try this once? But the problem was we would try these things in country somewhere. That knowledge, that wisdom that we gained from that experience was not captured in a way that then could be transferred to the next generation or the next NGO that came in or the next faith-based organization that came in to save the world. And so I started working at that intersection of how do we take what we've already learned, the intellectual, the social wisdom and knowledge, and put that into a form that we can manage. And so that's sort of a very kind of skimpy definition of knowledge management, but that's when I got really involved with the World Health Organization. And what I've heard, I'm just the fourth one in the line here, is that a lot of times it really is just serendipity. When I was, disassembling toasters in the garage as a kid, I never knew that I would end up spending time in Haiti or, down in Chile, or, most of my work is done in Latin America, not Africa. And I would have never guessed it, but you just kind of end up there sometimes. And my God, what a wonderful journey it's been. And it's not been planned. And a lot of it has been risk. And a lot of it is about stepping out of your comfort zone. And I tell people all the time, if you're feeling too comfortable in what you're doing, then you're staying. You need to move on. It has to be a challenge. So anyway, in working with Hopkins, directing their collaborating center for knowledge management, I got very involved with the World Health Organization. And then as things sort of started to emerge, and ICT, or Information and Communication Technologies, became quite commonplace. Everybody in God's creation has a smartphone, right? All of a sudden, it was sort of this, the growth of the e-health and the m-health movement. So you know what m-health is? M-health, mobile health. E-health is electronic health. Well, mobile health is in essence saying that we don't have to have fancy computer systems and multi-billion-dollar integrated information technology to take advantage of what exists in these countries. And many of these countries have leapfrogged over what the US has done. So they're not pulling wire, they're just going right smack for the cell phone. And they're using these cell phones in very interesting ways. So as this sort of started to bubble up, maybe in, let's see, maybe about 2005, it was very interesting. I got a call from the Rockefeller Foundation, and they invited me to go to Bellagio. I said, twist my arm, that's far enough, in Italy. And so I went to the Rockefeller Villa in Bellagio, Italy. I looked everywhere for George Clooney, but I had my little binoculars. I never saw him, but we worked really hard for a week on something called Making the eHealth Connection. And from that meeting, the whole mHealth Alliance sort of came to be. And mHealth Alliance is a large group of people who are working with mHealth technology, particularly in low-resource areas, to affect health and well-being. And again, serendipity, just happened to be in the right place at the right time, and I was a weirdo, you know, because they were like, oh, here's someone who understands the health side, but my God, she also knows something about technology. She knows something about designing for the user so that people could actually use this stuff and derive value from it. So, I mean, I feel like I've sort of been blessed in many different ways my whole career. I would have never expected to be where I would be. So if I have to say, I know I only have a few more moments, but if I have to say what it is that I do, well, anyway, I left Hopkins. I came here 2.5 years ago. Yeah, thank you, sweet. And I followed my husband here because my husband took a position here. I had a big grant at Hopkins that wouldn't move, so we were doing a commuter relationship for a while, which I did not like. And so I left my position at Hopkins and came here, and now I work for Leslie. Yeah, no, in the Office of Global Outreach in the School of Nursing, although I do teach and do other things. I actually have an international Fulbright scholar who's here with me for a year as a postdoc, sitting right back here. Her name is Sayonara Boboza. Right. She's from Brazil, and she just arrived in September. So anyway, I'm just delighted to have Sayo here. It almost makes me feel like I'm home again. It's the first time I've lived outside of Maryland in my whole life. My family goes back to 1640 in that area, and we've always been on boats pulling things out of the water. So anyway, to finish out, I guess I would say just what really jazzes me, excites me about what I do. Besides the fact of being here at Michigan and in Ann Arbor, it's a lovely town, it's a great place, and I love to teach. I love working with my students. It's really the percentage of my time that I spend with the Office of Global Outreach and Leslie and her group, because, and also with some of the other folks on campus. And what I'm really intrigued with, and what I have seen over time just conceptually, is when you can facilitate information liberation, data libre, so that you can give someone, so I've done work in Western Guatemala with the Mayans, when you can give people a cell phone and the technology to begin to sort of take control over the information that surrounds all of us, that's when remarkable things start to happen too. So they begin to sell the cell phone services, and then they use the money they make from the cell phone services to start paying for immunizations. And as the immunization program takes hold, there's a lower sickness rate, less missed work. Then they had enough money from selling the cell phone services to pay for a teacher. I mean, and all from something as silly as a cell phone, or what we would take as silly as a cell phone. But when you offer that to someone in a vulnerable population, a low resource area, it can really make the difference between life and death. And I've seen that firsthand, and that's what floats my boat. And I guess did I cover everything I'm supposed to? Okay, cool.
Yes. All right, so from here, our plan was to take questions from the audience, and maybe I'll use moderator prerogative to ask the first. So I mostly have a history of teaching, graduate students, master's students, and doctoral students in public health, and medical students and medical residents. And so I'm teaching an undergrad class right now. So I have, and I know some of them are in the audience here, they come to see me, and a lot of them have questions about obtaining a global health experience after they receive their bachelor's degree. And I wonder if one or more of you could comment on what opportunities there exist for individuals with a bachelor's degree in terms of their education, no matter the area. What type of opportunities? Are there job opportunities, or are they mostly fellowship and training opportunities? And this really is for any one of you.
Obviously the path I took was joining Peace Corps. I think Peace Corps is a wonderful way to go if you're so inclined. One, because it's a great way to get experience. It's truly a wonderful thing to do. Also, there's so much brand recognition with Peace Corps that basically once you have completed that service, you never have to explain it to someone. It's instantly recognizable, and I think it's fairly credible. It has a reputation, which I think some other opportunities may not. It's all expenses paid, so that's also a nice thing. And I think that it's a relatively sort of low-hanging fruit in terms of competing for other types of opportunities. I can say that at JSI, are in the international division as well as the domestic division, although I'm less familiar with the domestic division. In the international division, our program coordinators, half of them have bachelor's degrees only, and half of them do have master's degrees. So a master's degree is not required. It is an incredibly challenging job. I guarantee you it will be the 2 years or 3 years that one spends as a project coordinator is probably worth about 6 years in graduate school. There's a sense of camaraderie and respect, I think, respect of self and respect for others that comes out of an opportunity like that. JSI also does offer internships, both like year-long internships as well as like short fall and summer type internships. And I think that all of these things can be researched on the website. I would also plug World Education is an education-related nonprofit that is also, it's a sister organization to JSI. The JSI president is also the president of World Education, and we are co-housed in Boston. World Education, I'm sure, also is always looking for great people, so that's another alternative. And they focus on education programs, education and development programs around the world, as well as they do a lot of domestic U.S. literacy and adult literacy and transitioning at-risk Americans into the workforce and things like that. So those might be just some opportunities to look into.
I would really second what Francis just said about Peace Corps. Many of our fellows who are the kind of more senior level folks that already have a master's degree have gone through Peace Corps. And one of the things that's so great about that is that, so from a recruiter standpoint, they're going to have these certain little boxes that they need to check off. And Peace Corps definitely checks off a number of those that are of concern. Ability. And it's all about, can you be effective in the job that they're trying to hire for? And so some of the things that Peace Corps is really going to be valuable for is, are you able to navigate successfully in a culture other than your own? Are you able to navigate successfully in a resource-challenged environment? Those two skill sets are really important for the positions that we have. And but the other thing I'd like to say is I always sort of temper that if that's not in the cards for you, because it is a big chunk of time and people's own personal situations are different, if you can think about the possibility of doing something shorter term, because it all counts. For example, if you belong to a church that does mission work overseas. That's another possibility. So kind of look into your own network and see, are there other things that I can be doing that are going to get me those kinds of skills?
Shannon, this one's for you to take off on that. So, like me, you have a background in domestic work. My first job after I finished my medical and public health training was at this Detroit City Health Department, and I actually worked there for a number of years and worked in public health practice for 18 years. So would it be your recommendation, and certainly those skills have served me well working in India and China, which are the places that I work, would you make a direct recommendation, in fact, to work domestically before you go out internationally, whether at the bachelor's or master's level?
I would recommend one or the other, but I do find in my skills, I would say don't discount domestic work if you aren't able to secure international work, because there's immense value in building your skills. I learned once I began working at FHI 360 that they were literally within a day of offering someone else a position, but then my resume came through, the recruiter recognized that I had more domestic experience, and so their focus was on those skill sets and the fact that I had worked with researchers while I was in Houston, for example, conducted a needs assessment. So an international development organization saw that as an asset. So I would say, I don't recommend one way or the other, I think, but there's still immense value in doing domestic work as well. I know some people are focused on strictly getting that first job in international development. And if you can, great, but at the same time, don't feel as if you need to wait a year to get started working because you're still searching for that international opportunity when there are lots of domestic opportunities, and maybe you can gain skills in working for a year or two and also still afterwards pursue your international development interests.
Can I add something?
Sure, please.
Take this thing out of here. Here we go. Easier. Huh?
Problem solver.
Right. That's right.
I'll tinker it apart
in a minute and figure out why that one's not working. I want to add to that is that, and what I have discovered at Hopkins, the project that I was doing there was working with African American congestive heart failure patients, and at the same time, you know, visiting Guatemala. And I have to tell you that I was 8 blocks from the #1 school of public health in the United States, and it was Armageddon. And so it really brought home to me is that you don't have to go far to find vulnerable and disconnected populations. And I would also remind that we do this with our students as well, is that the Detroit area actually has the second largest density of Arabs outside of the Middle East. And you can, if you're interested in working in really culturally intense environments, you can just go a couple miles down the street. You know, you can go to Dearborn, or you can head into Detroit and find really vulnerable, disconnected populations. And so while you're waiting for that job, don't wait. There are people that could use you, and there's a lot going on.
Yeah, I just wanted to add to that. A few years ago, the Global Health Fellows Program did a webinar, much like what they're doing soon. And, you know, they made the point that working in Detroit would be more valuable to you than working in Europe. You know, a lot of students think international experience is international experience, but working somewhere that's much like here is not going to be as valuable to your future as working right here in your own backyard in a, you know, highly disadvantaged community with a lot of poverty and a lot of problems. So that's a good point, Patty. Thank you.
Questions from the audience? Yeah, right here. And if you could speak, if you could identify yourself and your course of study, and then speak loudly so everybody can hear your question.
Okay. I'm Anna. I'm a dual Master's in Public Health and Master's in Social Work student. And 2 questions. My first one is I'm looking for my public health internship currently for this coming summer. And I'm wondering how do internships at smaller, kind of like local in-country nonprofits versus internships at like large international organizations like John Snow that have, you know, work in multiple countries compare in terms of finding a job afterwards, in terms of both like the skills you gain at both, and the networks and connections you can make? Is there an advantage or disadvantage? If it's speak to that at all?
I can speak to the networking aspect of it. I believe I mentioned that my internship supervisor at Africare Zimbabwe connected me with capstone opportunity for when I was completing my Master's of Public Health program. I'm still in contact with her, and she's is working with me to facilitate partnerships in my current role, which is also an asset to the organization. But I also, when I was in Houston, Texas, I was recruited to do a domestic, coordinated domestic research project in HIV/AIDS in Houston, Texas by someone who was working for an organization that's based in Durham, a consulting firm by the name of Symetrica. It's a coincidence that recruiter who hired me for that opportunity now works for an international development organization in Durham and has contacted me about opportunities there as well. So even though you have a connection where you're doing domestic work, that person may end up moving on to another opportunity where they're still working in the public health realm, but it's global public health, and you have that connection. They can provide you, and they connect with you with other opportunities. I'm sorry.
I don't actually know what being an intern would be like in a small organization, because I haven't actually been an intern myself in really a long time, I'm sorry to say. But I do know that JSI does have, we have interns within our offices here. We also actually, I forgot to say, have interns in our projects overseas as well. And again, I think you can just check out our website for those. I think obviously the networking opportunity is important, but I think that just being around people is not necessarily as important as what you do with, the relationships and the sort of engagements that you have. So, I think that no matter where you are working, sort of making those relationships count, doing the best possible work that you can do, really, taking an interest in those who are working around you and sort of facilitating them in taking an interest in you. I think those are the more important things to concentrate on rather than the location. I think that probably just trying to make the best out of whatever situation you find yourself in. But I do know that working at JSI is very educational, and we have an actual JSI intern here, so I'm sure she could validate that.
And maybe I can put in a plug. Actually, Joel Lampstein, president of John Snow International, is going to be at the School of Public Health next week. Chineri, when is that? That's
on the 30th, which is next Thursday, from 3 to 4 in 2695. It's a small room, so get there early.
Yeah, so he's going to be talking to students, so you're more than welcome to attend.
I wanted to say something also related to that question, though, and that is that whatever job you can get, there's always going to be a network of other people working in that country or in that community. If it's Washington, D.C., there's all kinds of networking opportunities. So you're never limited to the network that works at your agency. So even if it's small, and sometimes small organizations can be interesting because you get to do a little more because they don't have the capacity for hyper-specialization. But just don't forget that, if you're in Zimbabwe working on maternal and child health, there's another organization doing that too. And you'll have many opportunities to network across organizations, no matter how large or small is the organization that you work for.
I'd like to say something about that too, if I could. Thank you. So for the internships that we have, those folks are working in Washington in the Global Health Bureau of USA. So that obviously is going to be a very different type of experience from working for a small NGO. However, there are very, I think, value to both, but you're going to get a very different experience. So if you're working in the Global Health Bureau at AID, you're going to get the opportunity to see how this huge organization functions and how the money moves and sort of all the different pieces. And there's great networking opportunities. There's also opportunities to travel overseas as part of that internship, but still it's not going to be the same thing as working in country. Then working in country, you're going to have what other people have talked about already, also very valuable. So you want to be able to think, well, are these going to be things that are going to help me move, ahead in my career, essentially.
Other questions from the audience? Yes, way in the back. So who would like to handle that one?
I can speak for FHI 360 specifically. Typically, our professionals who receive expat benefits and are based abroad, they have extensive experience and they feel a skill set that can't be otherwise filled within in country, because we do in-country recruitment as well. So for FHI 360, more than likely you would begin your career domestically at one of our domestic offices, build your skills and expertise, and if you were seeking an opportunity at one of our country offices, you would then transfer for one of those opportunities. In terms of short-term technical assistance, as we call it, STTA, experts who live domestically and who are able to travel frequently to provide expertise on projects, again, those opportunities tend to be for our staff who have extensive experience and who began working at our office domestically, but likely have significant experience working in country.
I would say that it's similar for JSI. I think that one of the values that JSI holds throughout all of its overseas projects is that we actually really firmly believe in local capacity and local staffing. So unlike some organizations where a project, out of 100 staff, you might have 15 international staff, we may or may not have one. So many of our field projects nowadays are actually entirely local. And so, of course, in that situation, the numbers are just not in your favor necessarily. And as Shannon said, the director level, which does tend to be perhaps the one international or the finance director level, that does take a level of expertise and experience and judgment that, it sort of takes a few years to accumulate. I think, though, that in smaller organizations, just as Chinero was saying, sometimes you end up literally wearing every hat. And so I think the smaller organization, actually, you may find yourself exactly in that situation. And in my case, I just went overseas without a job and actually just knocked on doors. And I offered to work for free, I offered to do anything. And eventually, I found someone who was willing to actually, give me something to keep myself busy with. So I think there are lots of different ways to go about it. I think that there's probably, it's not to say that it will not happen. Potentially the level of work, if you see a job that you like, though, look at the skills that are required and be realistic about whether you think you're at that level.
Yeah, the being realistic part, I think, is really great advice. And then also, just kind of tailoring your materials to that scope of work, so that if you have the skills, that it's easy for a hiring manager or recruiter to see what it is you have. Because when you've got this huge stack of resumes, someone's only going to devote a couple of minutes to each one, and if they don't see what they're looking for right away, they're probably going to move on. And so if it's murky or unclear, you might get put into that recycling pile. So you want to, really think about what you're doing there in terms of the material that you present, because at that point, all we have to go on is that piece of paper or that electronic file. We can't talk to you at that point. And then just from Global Health Fellows' point of view, the jumping off point for our positions would be someone who at minimal has a master's in public health already, or similar degree, plus a couple of years experience already sort of under their belt, and that's kind of at the junior end. And which was one of the reasons that we decided to partner with Global Health Corps, because we were pretty light on those really entry-level fellowships. So we felt this was a way that we could, sort of fill that gap.
So Robert, in that 2 minutes that you're looking at that giant pile of applications, and you're spending 2 minutes on each one of those, in 10 words or less, and I'm going to ask each of you to do this, what are the things that you look for in that app that are going to catch your eye, that's going to make you at least interested enough to say interview that person?
Well, if I could, I'd start off
That's
by
7 words.
what would make me put it in the recycling pile, which happens all the time, and people think, oh yeah, I'm never going to do that, but a lot of people do, is it has to be really well written, and there can't be any grammatical errors or mistakes. And that's like, you know, and it happens so often that, you know, people say, oh, I'm never going to do that, but a lot of people do, and then they get dumped, you know. But the things I would be looking for is something really well written and specific to the position that they're applying for. Those 2 things.
Shannon?
I work on the proposal side, so in terms of recruitment, that's where I come in for hiring. And typically, for me, organization is really key. If I can zoom in and see what your language proficiencies are relative to what the requirements of the position are, if the requirement, if there's a header that says in-country experience, and I can easily just zone in and see if you match, so that I can quickly move on to the next resume. That's what I look for, is organization and how quickly I can look through your resume, because working, at least in my role, we're working on multiple proposals, and we need to quickly see how we can fill these roles that we want to be filled for this bid that we're pursuing. So I'd say organization is really a big concern for me.
Fran?
This is actually really a hard one. I would have to agree entirely. I think that format, form, and obviously detail, orientation there are huge giveaways in terms of what kind of a worker you will be. So I think, you know, probably the answer that you might have been expecting is something related to content, and we're here focusing on actually style and form. But I think that that's actually very indicative of what people are looking for, which is attention to detail and, you know, diligence and care and actual interest in the thing that you are asking about. I think that if you feel that, you know, you've just ripped off 40 of these on the printer and pushed them into envelopes, obviously that's not going to be terribly appealing. I will say that language skills are very, very special. And so, you know, I wish I had some, actually. And I think that definitely differentiates you, and it makes you extremely valuable. You know, in the JSI Boston office, you know, a single individual might be backstopping projects that are both in French-speaking countries as well as Spanish-speaking countries. And we might be actually writing proposals entirely in Spanish, for instance. And so I cannot actually help in any of those activities, which, you know, I actually really wish that I could. So I think that especially as a younger person who may not have other skills yet, language abilities are very special.
That gives me a chance to give a plug for our program Monday, the 27th, from 6 to 8 at Palmer Commons. It's about how you can gain language skills even if you don't have any yet. There'll be several speakers to talk about the importance of that, but also speakers to talk about how to fast track language skills even if you don't have them, or how to revive some from, you know, like that high school class you took 6 years ago and kind of forgot.
When is that?
It's the 27th, which is next Monday, from 6 to 8 in Forum Hall of Palmer Commons.
Okay, well, I'm not sure I can really add too much more to what was already mentioned, but I would say the language issue is huge when we're looking for students to participate in internships and things of that nature. It's, you know, how closely do they match? I will also, just as an aside, say that some of the bigger groups, like, most of you, I guess, participate in DevNet, which is a job posting board for international. It's called DevNet. DevNet runs something called spiders, web spiders. So they actually go through and they're looking for terms that match what is in the job description. So if they ask specifically if you speak Spanish, the spider goes through, they can scan through 150 applications in a nanosecond, and they only pull out the ones that have Spanish. The word actually appears. So there's a computer angle to this. I know it sounds kind of like Big Brother-ish and stuff, but you have to be really smart when you put these things in, particularly to really big agencies. A lot of them, the small agencies may have a human actually looking at them. We do, but bigger groups are using web spiders.
Additional questions from the audience? Yes, young woman back there. If you can stand up, identify yourself, and just say a bit like what your course of study is, that'd be great.
I'm a senior undergraduate student, but I'm applying to local schools right now. So from what I've seen so far, it seems like a lot of, especially research, is done by MD and PHs. So I wondered if not having an MD, does it limit you in any way in terms of public health, like in terms of your ability to certain programs and stuff?
Well, I work with a lot of researchers in North Carolina at our office there. We have several master's prepared researchers, research associates, research assistants. If you want to serve as a PI, typically, to be more competitive, we typically list our PhD prepared staff. But a lot of our master's prepared staff are extensively involved in research projects, data collection, reporting. They're even being able to get published. So you can do research as a master's prepared professional. You may not be leading a lot of the studies, at least for FHI 360, but you'll still be able to get that experience. I have friends who've worked for 10, 15 years for the organization as a research associate and are immensely valuable. And technically, they're honestly doing the majority of the work on the project, but we just need to have the PI for professional purposes listed as a PhD prepared person. So you can be a researcher with your master's degree only.
Well, for our program, the positions that we have, each one is different. They're not so much research focused. So for our purposes, in most cases, the fellowships would be primarily somebody with a master's degree. Although there will be some that are looking for somebody that has an MD or an RN or some other degree. But I think the majority would be master's level.
I'll just add something. I probably don't need the mic because I have a loud voice, but
All right, I have the mic. I have to tell you, I didn't go back for my PhD until I got to this point where I decided I have my own questions I wanted to ask. And as a master's prepared practitioner, I was a nurse at the time, working in a geriatric research and education clinical center, which was a research machine that runs through the VA, Veterans Affairs. And as master's prepared, I spent my time answering other people's questions. And after a while, I just said, you know what, I have my own questions I want to ask. And you could sort of ask them, so you can be really involved. But if you want to lead it, you're going to need a PhD or a, higher research-oriented degree.
So I might say something too. So I have a large research group at the School of Public Health, and a lot of them doing global health work. So I have 5 master's level trained individual in addition to other research faculty who would typically be at the doctoral level. But interestingly, one of my master's level individuals, he has his master's in health information technology, which is reflective of how important that's become with regard to moving large data from one country to another in a secure fashion. And I have another one of the individuals has a master's in library science, because doing literature searches and organizing for the research and also assisting as a resource to our partners in other countries. She actually builds informational databases for them to access medical and public health literature that they can use for their own research in partnership with us. So, and it sounded like part of your question might have been about MDs. And U of M is not, there are some schools of public health that physicians comprise a large proportion, but that is not true at all here at Michigan. In fact, it's not true of most schools of public health. By and large, most public health researchers are not physicians. It's actually very much the exception rather than the rule. There aren't that many of us that go into public health careers. So that's not at all necessary. In fact, it harkens back to an older model, and you still see it at some schools, but most you do not, and it's not at all necessary. The vast majority of individuals I train who go on to be faculty, for example, do so through a PhD. Other questions? Yes?
Hi, so I'm a sophomore from undergrad in LSNA. So I was
And if you could tell us your name too, that's always nice.
Sorry, my name is Desiree. So I was just wondering what advice you have for me as an undergrad who still has time to kind of gain experience and form a stronger application. So for after graduation, deciding what I want to do. Peace Corps has been something that I've always been interested in. So just tips or things that you wish you would have known when you were an undergrad for all of you, or what you guys look for in undergrads.
Who wants to field that one?
I could say
Barbara?
something about that. I mentioned earlier an organization called Globe Med, which we fund some of their internships. And since you're a sophomore, I think that might be a good thing to check out. Because the way that works is that there are chapters on campus, and they pair, the Globe Med pairs up each chapter with an organization in country that you get to work with virtually throughout the year. So you get to learn about them and understand, what they're doing and the work that they're doing, and be, involved at least on a virtual level. Then in the summer, they have internships overseas where you actually go and spend, I think it's between 6 to 8 weeks working there with that organization.
You had a question?
Yes. Hi, my name is Michelle, and I am in my 3rd and final year. I'm a dual degree master's student in the School of Public Health as well as the School of Natural Resources. And that said, I've spent the majority of my adult life in school, and I have had a few international opportunities, mainly through the summer, and I've also worked on research projects throughout school years. But I'm at that process now or at the point now where I realize that while I will have a master's, I'll have 2 masters coming out, I will not have much work experience. So how do I leverage my educational experience as well as my shorter term work experience that I have had, even for positions that may call for like 5 years plus of more field work or work experience, both domestically and internationally.
Who has a solution to that?
Oh, boy.
That's the catch-22.
Yeah.
Exactly, yeah. How do you get experience when you have very little experience? If I had to answer, I mean, obviously I would be a billionaire. We all find ourselves in that situation. And clearly, we don't all end up stuck in that situation. So the good thing is that something will happen. I promise you something will happen. I don't know what it is, but something will happen. I think what probably you will end up doing is just talking to a lot of people, maybe interning, maybe volunteering, maybe taking a position that sounds perhaps a little bit like, maybe is undershooting a bit from what you thought you might be doing, but in fact offers a lot that you didn't even realize you had to learn. And you may not even appreciate how much you've gotten from that experience until you're done with it. So I think that is there a way to get a job with 2 years of experience when it requires 7? I don't know. Perhaps, maybe if you're really, really lucky, or if in fact you have some other skills that are outside of that 7-year requirement. But I think again it goes back to putting yourself out there, taking some risks, and just trying to talk to as many people as you possibly can, and really just offering anything that you have to offer. So time being probably the biggest thing that you have to offer at this point. Also going back to Desiree's question before, I don't know if this is an option for you, but one of the things that I did when I was at Michigan was I actually audited courses that, so I didn't take courses for credit, but I actually sat in on courses that I was just purely interested in that might be maybe something that you're not allowed to take for credit, or maybe you wouldn't be able to pass. For instance, like I took a statistics course that I knew I would fail if I took it, but I just wanted to actually listen in and talk to people, and so that might be another thing that you could do. Also, one thing that I've done in the past is I've looked at the reading lists of various courses, and if you find reading lists and everything on that reading list looks interesting to you, then that's a clue that you're moving in the right direction. But if you find a reading list for a class and literally everything looks awful, that's a clue that may not be what you think it is. So that might be something, while you still have time in an environment like this, it's a buffet, right? So go for it.
I want to go back to the question about work experience and how to leverage that. Question that comes up, at least for me from students a lot, is why I have a lot of volunteer experience or short-term experience, and I break it out on my resume as volunteer or short-term. One thing that shifted my perspective as I was job searching before I graduated in 2005 was a tip actually Ms. Neal gave me when she was my mentor. She said, you have experience and you're gaining skills, you're of value to that organization. Why are you breaking out volunteer experience versus paid experience? This is professional experience. And also for internships, she also advised me to give myself a functional title. Don't just say intern, because it minimizes your role. You were a project coordinator, not just an intern. So those were two really great tips that I felt like I had a lot of volunteer experience, even some that were practicums as part of a course. I listed it under professional experience because we worked hard. We didn't just go and sit in the chair and, watch people work. We were actually doing work as part of a course for credit. So that was just something that helped me resume-wise begin getting interviews.
Yeah, I would really second that idea about giving some weight to the internships that you've done, because a lot of times looking at a resume, people give them very short shrift. There's just like a phrase, and you don't really know what it is that was done there. And just to give you an example, I was doing a resume review with somebody, and I didn't see any global health anywhere, And then on page 3, there was this really sort of vague thing about a volunteer work that she had done, and I couldn't really tell, was it overseas, was it here? And so I asked her about it, and she said, well, for the last 7 years I've been going to Uganda every summer and working with this organization. And I would have never got that. I just wouldn't have known by what she had written there. So if you have things that you think, oh, well, maybe that's not so important, think about it again and think about how you can use that to your advantage.
Yeah, I actually want to add to that answer too, and that is that I find that a mistake that sometimes students make is focusing on the job you want to end up with, but you have to start with the job you can get. Yeah. And so sometimes because we have a master's degree or whatever, we don't want to take that administrative job, but that administrative job gives you a chance to be there, number 1, to observe what's going on, number 2, to learn, number 3, and number 4, to make, to have your strengths and eagerness and whatever noticed. And you kind of talked about that a little bit, Francis. So if you can't get in the door at all because you're insisting on a higher level job than you're qualified for, then you haven't accomplished anything. Take the lower job, get there, prove yourself, get some experience, learn something, develop trust, and then you may find yourself in a much, a position much closer to what you look for. I tell students all the time, you're focusing on your dream job. If you got it, would you even know how to do it?
I will also add to that so-called administrative work is critically important. So, people often think like, oh, I only want to do quote-unquote technical work. And I tell you that if you continue to sort of ignore all of the learning opportunities that are in front of you, because you're searching for some mythological technical work. I think that that is a real, you know, sort of missed opportunity for you. And like I said, the skills that I've acquired in understanding, you know, I don't want to be the person who literally doesn't know how to, you know, send a fax. I mean, it's not okay to not know how the machinery works. And you will find days where basically you're the only one to operate it, and you'll be thankful that you know how.
I'm going to take a question right with this. Yeah.
Hi, I'm Colin. I guess I've eaten from the academic buffet a lot. I'm a final major in global health, and I'm minoring in Chinese and business. And right now I'm in a lot of business classes, and I'm asking them a lot of things about public health, and a lot of them are like, yeah, maybe we can make it work. So I guess I kind of want to ask similar questions to you about whether you can see relationships getting stronger with the private sector. And just kind of going with that, kind of looking at alternatives like grant funding and donor funding, and looking at other ways to kind of engage the private sector to look at like generating funding different ways. I don't know, just throwing out things.
I'd say yes to answer your question. We're seeing it for opportunities that we're pursuing, that there's a component called cost share in a lot of USAID funded opportunities, and cost share is often, I guess it depends upon the opportunity. I'll give you an example, 5%. How will you bring in resources that are non-US government funded to this project? It's a requirement in order to even submit a proposal and to be evaluated. Oftentimes at FHI, we look at our private partnerships to see how we can leverage those resources and those projects we're already working on, how they align with the opportunity we want to propose, and we can use that as cost share. You have to come up with an estimate of what those resources are. So for one example, just as an example, there's a partnership we had with a mobile health technology for-profit company. And they were able to donate a certain number of cell phones, which we came up with a value for and was able to use as cost share. We also have a partnership with Tom Shoes. They provide shoes to orphans and vulnerable children. We've been able to use that as cost share. So in terms of sustainability of programs, at least for me, I see USA is focused on how the private sector and public sector are partnering to ensure sustainability of programs, and just to make sure that resources are used efficiently and wisely and planned for the long term in communities.
This is a great question, super interesting. I think that, at least from my experience, in sort of maybe 5 or 10 years ago when people talked about engaging the private sector, it was mostly about corporate social responsibility and sort of tapping corporations for money as part of a sort of PR, activity. I think that actually now the space is moving much more into social innovation, social entrepreneurship, actually incorporating business techniques. Actually, that's not at all old. Marketing, advertisement, those types of techniques have been applied to international development for many years, most notably by PSI, for example. But I think that other business tactics and strategies and techniques are also being applied now to public sector work, if you will. And a lot of private sector now actually want to become active agents in development work, either because they are grooming markets or because they need natural resources to actually produce their goods. So it's not just about sort of these PR opportunities to look good and to have a little logo on your website. It's actually about incorporating the private sector, and I think that a lot of big organizations, as well as the US government, are trying furiously to figure out better ways of doing that and finding more and more ways to engage. Especially I think as public sector funds and donor funds, either are being reallocated or are decreasing, the private sector funds become more and more important.
I can add just a short story onto this a little bit. So I got funding from the university to do some educational outreach in Haiti. And so we wanted to pull fiber cable up to a town called Leogane. Leogane was the epicenter of the earthquake. And it was very interesting that in looking for a partner in Haiti to help us with providing these internet services. It was really interesting. There wasn't really anything there because everybody was in prison. So, for corruption. So I actually, it was nightmarish. I thought the project was over. But what I can tell you is I also serve on the World Health Organization. I'm a member of the eHealth Technical Advisory Group in Geneva. And through that group, I met somebody from Hanoi. And we actually ended up contracting through Hanoi to get cable connectivity up to the top of the hill in Leopold. And it's a sort of an oddball story, but the point was that had we not been able to find a partner in the industry, in the country, such as we did, even though they weren't really in the country, it was NATCOM through the Vietnamese military, which is very interesting. But that was what made that project work. And the other thing I will say is that I sit on a study section at NIH for the Biomedical Computing and Health Informatics panel. And I can tell you that any project that comes in for funding that does not have a very distinct sustainability plan gets nerfed, meaning doesn't get scored. So.
I had a quick thing I wanted to mention about that private sector focus also. One of our partners is an organization called Pixera Global, and they specialize in bringing private sector individuals into global health work for a short period of time. They take a sabbatical from their private sector job, and then they work overseas in their particular area of expertise for a certain, maybe 6 months or 3 months, could be longer. Then they go back, and so the idea is that that feeds into the whole idea of their emerging markets interest, and also it brings back what's happening in country, so that they can get that perspective, and also they bring their expertise, to that country, and also their salary counts as cost share for us. So that's a very nice thing for the cost share piece.
And even in academia, the lines are blurring with regards to the funding sources. Traditionally, NIH funding or NSF funding was the bar against which you were measured, and increasingly, so I have a large 5-year NIH grant in China, but most of my work in India is actually funded by a businessman's foundation. He happens to be an alum of Michigan, the Trahan Foundation, and his funding support is specifically for faculty members who are doing research that has an implementation in, so it can't just be go over, collect data, and publish a paper, but rather there has to be some measurable outcomes. And what's interesting is you can sense the entire dynamic is changing in academia in terms of the type of funding source for which you receive credit, which really is much more diverse than it was in the past. It's much less narrow, which is actually a good thing. When they're only funding 3 and 4% of NIH, international NIH grants, most people are not going to be successful in getting that. And in fact, it's a very different type of outreach when you're working with a foundation and you're putting forth a proposal to do some type of international work. Yeah, yes.
Okay. Hi, my name's Shannon. I'm a second-year MPH student. So I just wanted to add to some things you were mentioning for opportunities for students. So I was looking this year for a lot of research jobs, like helping out on research projects. You really want to build your resume, and I just wasn't getting them. There's so many students applying for the same position. So I ended up getting an office assistant position at General Pediatrics, which they end up doing a lot of research, and it's been a great experience to see how that research really is run by so many different people, and to have people get to know you, and also there are more opportunities when they know you for after graduation than there would be when the research position is over and you're no longer eligible for work study. So there's something for undergrads or incoming master's students. And then I had a question for you guys. So I'm interested in working in international or in domestic settings on international work, which seems like most of you are doing right now. And I guess there's a lot of talk about either going abroad or working domestically in the United States on domestic issues. So I guess is there like a large pool of those kind of jobs to, I mean, I guess I haven't really, it's usually people go into international work wanting to go abroad, I guess. But I'm not looking for that, so I was just wondering if you could.
Okay, so you want to work on international programs, but from the States?
Yeah, or, yes. Not
Okay.
necessarily like, it's tough. Like, I'm interested in international work, but right now in my life, I can't really prepare to go abroad, perhaps later. So,
I think actually you're probably in better standing than, you know, those who want to go abroad immediately. Because actually, again, you know, so just using JSI as an example, for instance, we have probably 1,000 employees who are in the international division who are based in the U.S. And so that may be overstretching. I can never remember numbers, but there are a lot. And the way that that happens is, one, we either have our technical, the way that our projects are designed, either sort of the technical base of the project is actually in the U.S. and those people travel consistently. And then there's a whole operations and machinery that has to exist in order to keep, you know, those contracts going and that HR structure and the whole operations moving. And so all of those people are also based, you know, in the U.S. in this case in our DC office. In our Boston office, in the Boston office we actually backstop or support, say 20 or so field programs. But each one of those programs needs a team back here supporting it, because there are some functions that can only be done there, and there are some functions that can only be done here. And so that by and large probably will always exist. And so I think that actually for you, you know, that model is actually probably, the chances of you getting a job that you're interested in is probably higher than getting immediately a field position with the JSI, for instance.
So one of the things also to think about is, you know, kind of being strategic in your thinking, and doing a little bit of research on different organizations that are out there, you know, like the ones that are represented here, and thinking about, oh wow, they're doing work that I really want to do, and then finding you know, opportunities to connect with them. And again, there may be opportunities here domestically, but then that could lead to something, you know, further down the line that may have that may bring you overseas. But if you know, and going to like conferences, excuse me, where there are a large number of exhibitors, where they're sort of all grouped in one place, and sort of picking out the ones that you've researched and thought, oh, these are organizations that really interest me, and then going there, talking to them, finding out a little bit more about them, finding out what the opportunities are, you know, making a connection face to face, that way can also be valuable. Yes?
Hi, so I'm Elizabeth. I'm a medical student on a year off between my second and third years. And my question is very similar, but I'm thinking more long-term in that I'm very interested in global health, but I'm not sure that, you know, once I'm out of my 20s and 30s, I want to live abroad, working, you know, at these project sites. And I'm wondering if there's a norm or an average for do global health professionals generally stay domestic, overseeing projects overseas, or do they generally go to projects overseas, stay for a couple of years, and move on to different projects?
How you classify it, it's really sort of all over the board.
Yeah.
Yes, you know.
I think it is a bit over the board, and all over the board, and also the field is evolving. And so, you know, there may be people in their 60s now who have spent the bulk of their careers overseas, but you know, the field has changed so much, and the way that we implement programs and the way that we manage programs has changed. And so it's not really fair necessarily to say, well, all of our 60-year-old staff have done this, you know, because I think by the time our 30-year-old staff are 60, they may have had very different paths. So it's a little bit hard to say. I think that for me, having had experience on both sides is very, very beneficial, because I don't think that you can truly understand what it looks like until you've seen it. And so I think that if you can get the opportunity, you know, take it. But I mean, there are plenty of people who have had very, very fruitful, long, productive careers who have done one side or the other, you know. So I think, again, it only limits you insofar as I think you let it limit you, and I don't think that there's really a rule. But I will say that experience is always good. You know, whatever the experience is, it will always put you in good stead. So just use that for what it's worth, and try, if you feel like you've got holes in your, you know, your sort of awareness or skills, then just try and plug those. And if you can't do it in a 5-year stint, do it in a 5-week stint.
The only thing I would add to that is maybe coming at it from a mature woman's perspective, in that, you know, at least in my life, I started off with one sort of idea, you know, stopped out of school, got married, had kids. Didn't really, I would not have really liked to have, I wanted to be in the U.S. to raise those kids. I wanted them exposed to U.S. systems, and, you know, not saying that every place that you would go is necessarily in conflict, but I wanted my children to grow up in the U.S. near their grandparents and these sorts of things. And then as they sort of move on and they've gone off to college, and the only time I hear from them is when they have dirty laundry or need money, you know, now it's kind of like, I can't wait to go somewhere else. Not that I don't like Ann Arbor, but things change in your life. And so I think it depends, you know, a lot of it's personal. What is it that you know, want to do? What are your goals for your, you know, young adulthood? And can those, you know, can you do short-term stints away? Or are you really interested in having the white picket fence and the family and the whole whatever? You know, it's such a personal decision. It's hard to say. But I would say that for me right now, I just, you know, if someone was to say to me, you know what, we have this opportunity in Thailand to work with kids from parents who's, you know, kids from parents who died in Banda Aceh or something, I would drop it and go, because I could do that. But when I was a mom with kids around, I couldn't. So,
Hattie, how much time do you spend abroad each year?
It has not been as much as I did at Hopkins since I came here, because I was directing a collaborating center, and I didn't go and stay for weeks at a time in a certain place. So I was doing like 1 week here, 1 week there, 1 week here, 2 weeks there, and it was mostly in a consultant or an advisory capacity around e-health or m-health. Except when I came here, then it's really, I got involved in the research projects and started doing stuff where I actually stayed in the country with a project that was mine, and that made me really happy. But you know, I don't know, not as much as I'm sure you guys are doing. You know, I don't know, what about you? You spent a lot of time overseas, didn't you? At one time, at least?
I did my 2 internships, and then in order to update my knowledge per se, to make myself more marketable, in 2011, I volunteered, I think, for 4 weeks in Uganda with the water project, and that helped to update my knowledge. But in terms of extensive work international, I actually didn't have a lot, and I was still able to leverage the experience that I had to work for FHI.
How about you?
So I spend about 2 months each year abroad. I was in India for 5 straight weeks this summer, and then I'll be spending a good part of December in China. And of course, as an academician, you have opportunities for sabbaticals, so my next sabbatical will be for a year, and I'll spend that entire sabbatical in India.
Wow. Oh, that's cool. I'm jealous.
Yeah, so it's a nice, you know, it's a nice mix. And of course, the masters, the people who are part of my research staff and their masters, so Brad is my health IT person. So Brad just returned from China, and Brad ends up spending, I would say, about 6 to 8 weeks abroad. So he was in India with me for part of the time this summer. Is in China, was at NIH training in Bangkok. I know the master's level individuals I have working as part of my research group think it's a pretty cool gig because they're based here, but they generally have 6 to 8 weeks, sometimes more, travel abroad as part of the research or programmatic activities that we're involved in other countries.
I wanted to mention, I guess it depends upon your concern about what phase of your life you'll be in and what that would look like in terms of global health. At FHI, a lot of our researchers who are, PhD or MD prepared or even master's prepared, there are accommodations that are made for people with families. I know one of my colleagues at FHI is one of our top researchers, and she has an infant. She was able to negotiate just one trip per year, an extended trip. I believe it was to Zambia, and she brought her infant with her. So even if you have a family, and you're at that stage in your life, you feel as if maybe when you graduate, you'll be ready for certain things. These organizations are accustomed to having people with families work for them. So you can still pursue your career and be at different phases of your life, be it one that's more flexible, where you can hop on a plane at any point and travel, or if you need to plan more appropriately for more extended stays with your family. So.
I was just going to say, most global health positions will say what the anticipated percentage of travel is right in the job description, but do the math, because 30% travel doesn't sound like a lot until you figure out what percentage of 220 days a year that means. But the other thing, Shannon was saying that organizations make accommodations. Sometimes that accommodation makes travel possible for people who would not ordinarily travel, simply because this person can't go, and so someone else can go in their place.
And I work on the proposal side, so usually our researchers are aware of how long, we write how long they'll be, if this proposal is awarded over the next 5 years, you'll be able to travel for 10 days per year. So once you work for an organization and they write you into opportunities, you can negotiate how many days you feel you'll need for your scope of work.
And if the job ad says, must live near airport.
That's an excellent way to end. Excellent advice. I think we're about out of time here, so if you join me again in thanking our wonderful panelists. And thank you all for joining us for this session of Careers in Global Health. We appreciate you being here.